It's terrific that the Minister for Mental Health and the Assistant Minister for Health has been able to come to address the meeting. Many of the projects that we're talking about, both within the awards who are finalists and who are not, are linked to mental health. Mental health issues are not isolated. They're part of the complexity of the system, and people don't just walk in the door with their diabetes. They walk in with a multiplicity of problems, and complexity, as we discussed this morning, is really an organizing principle or a disorganizing principle for the sort of care we need to provide in an integrated way. So it's with great pleasure that I welcome the Minister for Mental Health, Assistant Minister for Health, Rowell.
Well, good afternoon, ladies and gentlemen, and what a delight it is to be here this afternoon. I understand you've had a jam-packed morning, and I know that this afternoon's no different. I'd like to take this opportunity to thank a number of people, but before I do, to acknowledge the traditional owners of the land and thank them for their custodianship of country. In addition to my very good friend and Minister for Health, Gillian Skinner, I'd like to take this opportunity, Gillian, to thank you for all the work that you do and for mentoring me over the last 6 months since I've been the Minister for Mental Health and the Assistant Minister for Health. So thank you very much, Gillian. In addition to that, we have Secretary Mary Foley, board chairs, board members, chief executives, staff from local health districts, networks, representatives of all the pillars, Medicare locals, medical colleges, universities, many other organisations, including Baxter Healthcare and Cerner, who are continuing their strong association with innovation. I want to thank each and every one of you for being here today. Today we have over 1,000 participants from every part of the state and every sector of health in attendance at the New South Wales Health Innovation Symposium. It's very, very exciting to see so many of you here today. It reflects just how forward-thinking New South Wales Health can be. I'm absolutely delighted by the number of outstanding mental health projects that have been submitted to the New South Wales Health Awards, and even more pleased that some were chosen as award finalists. Well done. Encouraging innovation is a key part of the government's vision. Innovation has to be at the heart of New South Wales Health, and I know that it certainly is. After all, we're all here to serve the people. Every day, clinical and specific learnings drive the whole New South Wales health system to help people in need. Over 140 years, New South Wales Health has been at the very forefront of improving health services to benefit its consumers. We constantly adapt the system to meet the changing needs of our community, and you're all certainly part of that. Innovation can be about the way we clean our hospital or how we connect to the frail and aged in their homes. It's about community services as well as hospital and acute care. Innovation can impact the most straightforward, seemingly minor interaction through to the most significant breakthrough that may attract a Nobel Peace Prize. Innovation is about the curiosity and ambition to do something better. It can save lives, it can save money, it can save time or produce a more satisfactory way of doing things. It's the constant search to do it better that gives innovation such a powerful impact in our system. And it's that constant search, the constant sense that we can do better, that I'm here with Gillian Skinner to support in every possible way. But today's symposium is a great achievement, and I thank you, each and every one of you, for being part of it today. And I guess as the Minister for Mental Health, can I encourage you to come up with innovative ways as you deliver services right across the state? And as the Minister for Mental Health, there's three things that I'm very much focused on. The first is early prevention and intervention. We certainly know that by getting in early, there's certainly a better outcome for the consumer, and this certainly allows us to free up other resources to help even more people. The second thing that I'm very much focused on is for people that are already in the system in relation to mental health, that we continue to strengthen and secure additional supports, whether it be education, family supports, accommodation. I think it's very, very important that we also focus on those supports, and you're very much part of all of that. And I guess the third one is that we not just count widgets, but we certainly count and value outcomes, and that's what you're all here today about. So I certainly encourage you to come up with innovative ways as we transgress the mental health system, and certainly have our whole of government response to the strategic plan of mental health. But I do want to thank you again for all the work that you do on the front line. It's very, very important, and I hope you get as much out of the afternoon as we certainly will. Thank you.